ma'am, I am Anher Sawi from Section 12J of Davao Doctors College, and for today I'll be performing the perineal flushing. Now, perineal flushing is a hygienic care that involves cleaning the perineum and genitalia in the female. It is the area between the vagina and rectum. In male, the area between scrotum and anus. The purpose of this procedure is the provision of the patient's physical and mental comfort, to avoid infection from rectum and prevent disagreeable odor, to cleanse and promote healing and decrease the growth of microorganisms. It is indicated for patients in labor, postpartum, gynecological patient, during perineal repair, diabetic patient, and patient and catheter. Now, prior to performing the procedure, you have to check the doctor's order for the need to assessing the patient. This is to accurately perform the needed procedure to the right client, and you have to prepare all the needed materials and wash your hands. Now, the materials we have today is a picture full of warm water, our antiseptic spray, gloves, our kidney basin, our bedpan, and also our pickup forceps. This is the one. Pickup forceps. And our working forceps. And then we have our maternity napkin. And also a jar with cotton balls and cleansing solution. And then our jar with dry cotton balls. And our draw sheet. And lastly, a rug. Time and effort, also washing hands to deter the spread of microorganisms. Now, the third steps would be explaining the procedure to the client, but before that you have to introduce yourself and verify the client's identity using the two identifiers. Good morning, ma'am. I am Anher Sawi from Davao Doctors College, your student nurse for today. Can I have your name, ma'am? Your first and last name? My name is Jenny. Okay, thank you. So for today, I'll be performing perineal flushing. So perineal flushing involves cleaning your perineum area. And do you have any questions? No. Okay, thank you. Now, explaining the procedure to the clients and also introducing yourself and verifying the client's identity it is to establish rapport, and verifying the client's name ensures that you are doing the right procedure to the right client. And explaining the procedure to the client allows cooperation. Screen the patient or lock the patient's room. This is to provide privacy. Put draw sheet on the patient's bed to avoid wetting the area of the patient. Put a rug or newspaper to maintain cleanliness and avoid wetting the floor. We have a rug here. Also, our draw sheet. Now, put draw sheet and don't forget to put the side railings up to prevent from falling and maintain the patient's privacy. Ma'am, pwede ka mo tagilid. Sige, ma'am. Now, put side railing up. Ma'am. Sige, ma'am, balik na, ma'am. Position the patient in dorsal recumbent position and put patient in bedpan. Also, drape the patient properly, exposing only the area to be examined or cleansed. Ano tiil, ma'am? Bikang kang, ma'am. Salamat, ma'am. So, ma'am, ibutang na ko ang bedpan, ma'am, ha? Stop. Positioning the patient in dorsal recumbent position provide patients comfort and to visualize properly the area to be cleansed, and minimal exposure lessen the embarrassment of the patient and provides warmth. Get cotton balls soaked in cleansing solution using the pickup forceps. Now we have the cotton balls that soak in cleansing solution. And we have here our working forceps and the pickup forceps. Also our kidney basin. Now you have to make sure that the both forceps don't touch each other to maintain the sterility. Flush the perineal area with warm water. Before that, don't forget to inspect the perineal area for any abnormalities such as swelling, inflammation, excessive discharge, and presence of odor. And use warm water, for this prevents chilling and dissolves or softens blood clot. And flush starting from the midline of the symphysis pubis down to the anus. And never repeat the stroke to prevent contamination. Now you have to flush the perineal area with warm water, and you have to start from symphysis pubis to the midline down to the anus. Now you have to pick a cotton ball soaked in a cleansing solution using the pick-up forceps. So we have here our pick-up forceps. Get one cotton ball, and with our working forceps, make sure that the two forceps doesn't touch each other to prevent contamination.
Go.
Now start from the symphysis pubis down to the anus and discard. Now you have to, with another cotton ball, you have to clean starting from one's pubis. Always start from the area that is away from you. Now you have to start from one's pubis on figure of 7 by way of external labium towards the anus, like here, then to the anus, and then discard. Now the other part is done. You have to do it on the opposite side, from one's pubis and external labium down to the anus, and then discard. Another cotton ball, you have to start cleaning from one's pubis again. Always start from away from you, on the part away from you. Start from one's pubis and the figure of 7. You have to start from internal labium towards the anus, and then you have to discard. Now you have to do it on the other side. Again, from one's pubis on the figure of 7, one's pubis to internal labium, down to the anus, and then discard. And then after that, with another cotton ball, clean the groin starting from groin up to the thigh. Use the other side of the same cotton balls for near groin, and I'm going to use the check side, and also never repeat the same side of the cotton ball. Always start from the area away from you, here, then other side of the groin, then discard. Alright, so with another cotton ball, you have to clean the area away from you, or the groin area, and also don't limit yourself with one cotton ball if the groin area is too dirty and needs to be cleaned properly. Don't forget to never repeat the stroke, and discard and do it on the upper side. Now again, we here, then with the other side, and discard. Then another cotton ball on this area, and then other side, and discard. With another cotton ball, and then the other side, and discard. Using dry cotton ball, dry the perineum with the same stroke as what we did earlier. Again, first cotton ball, starting from mons pubis down to the anus midline, then discard. Mons pubis, the midline, down to the anus, and discard. With another cotton ball, always start on the area away from you. From mons pubis in the figure of 7, mons pubis, and external labium, down to the anus, then discard. Again, another cotton ball, dry cotton ball, from mons pubis on the opposite side, from mons pubis to the external labium, down to the anus, and then discard. Now again, another cotton ball, dry cotton ball, from mons pubis again to the internal labium of the other side. Make sure to start from the area that away from you, down to the anus, and then discard. With another cotton ball again, do it to the opposite side, which is internal labium again, from mons pubis, internal labium, down to the anus, and then discard. With another cotton ball, a dry cotton ball, you have to clean the part of the groin, starting from the area away from you with the same stroke, but never repeat the same side of the cotton or dry cotton ball to dry the groin. So just like this, from here, here, then the other side, here, then here, and then discard. Now on the other side, now with another cotton ball, from groin, and then other side, and then discard. Another cotton ball from this area, other side, and then discard. You have to get another cotton ball, other side, and then discard. Turn the patient on her back and make her comfortable, and spray antiseptic as needed. Ma'am, tagilid sa ta, ma'am. Oh, it is necessary to clean the buttocks. Get another cotton ball, a dry cotton ball. You have to clean from the anus, which is the cleanest area, to the buttocks, and then discard. Now get another cotton ball, again from the anus to the buttocks, and then discard. Antiseptic spray promotes healing, and put the perineal pad in an up-down motion as needed. For this perineal pad will prevent contamination of the vagina and use urethra of the anal area. You have to put the antiseptic spray. Now we have to put the maternity napkin. Now with the maternity napkin, now, salamat ma'am. Ma'am, tagilid na punta ma'am. Put this on a laundry bin. Don't forget to put the side railing ups of the bed whenever you turn the patient around to avoid any injury. Now do aftercare for the material used. Discard used cotton balls and water in the bedpan. Sterilize the forceps and place the materials on their appropriate places. You have to discard your gloves onto the trash bin. And now we have to discard our used cotton balls, which is in our kidney basin. And we have to put this back on, put the lid back on, and put this on the area where it belongs. Record the treatment done to the patient and discharge observed. This is for documentation purposes, and lastly, don't forget to do hand washing. This is to deter the spread of microorganisms.